has benefited us extremely well. We were able to work with the various systems to provide our evidence-based practice and then really gain good understanding of how the other systems approach diabetic care, quality and delivery of care of the diabetic patient.
All of us is smarter than any of us, and I really see that when we're working in AboutHealth, that we get to work with some of the top quality health systems in the whole state. And it's very open, it's very sharing, it's very important for us to progress using the AboutHealth model.
I think the biggest improvement was deciding on the evidence. We decided on the evidence on the first day. And as we move forward, I think the second best opportunity we had was the many check-ins with the various groups amongst the populations. So whether that was the diabetic educators, the administrators, the providers, etc., quality folks, we were able to really start to tease back and understand how we definitely can improve across the continuum.
When we look at the metrics, the WCHQ metrics, we've moved from having 6 to 9 that we track over time. We've moved from having 3 of the 6 in our goal range to having all 9 of those in our goal range. When I go to the AboutHealth meetings, no one has it perfect. We all have our challenges, but there's so much commonality in our challenges and what we're trying to do that it kind of builds that team effort. And then I take that back to ProHealth Care, to the medical group, and share that with our physician leaders, who then share it with all our providers. And we have that strength in numbers and that strength with many, many people aiming at the same high goal of excellent diabetic care.
It's allowed us to look at our workflows in the clinics and make us more efficient, both from the staffing standpoint as well as from the providers. Not only looking at it from the diabetes standpoint, but once we had our workflows in place and saw how well it was working, we've now been able to really roll it out to a lot of other chronic diseases.
Learning from others who also utilize the same EMR that we do, Epic, the workflows, and how they have hardwired those with their staff and providers to make sure that the data that we're reporting out is retrievable and in discrete fields has been a big benefit to us, learning how to utilize that system and standardizing that work.
I think we're quite proud of our diabetes improvement. We've had significant improvement over the past 2 years since we started really concentrating on it. We've really looked at the process. We've used the recommendations and the algorithms that were set up by AboutHealth and really have hardwired those into our workflows now in the clinics, again, making us much more efficient.
I think the scorecard that we get every month is just a way of visual management that puts our data right out there in front of everyone, from administration to providers to staff. It's very visible to see from month to month how you are doing, and it's also very rewarding with the diabetes metrics to watch your quality scores improve and get higher and higher each month, knowing that that has a direct impact on the patients that we care for.
We refer to it as being with the best of the best. So it really makes you step up your game. It makes us better. So I think we found it rewarding. It's challenging, but it allows us, I think, to step up our game and to continue to excel.
I've been working with AboutHealth really since AboutHealth formed and helped lead the first on-site collaborative about diabetes and continue to work with the Diabetes Improvement Collaborative. What I've enjoyed most about it is really the collaborative nature of all the organizations getting together and sharing best practice, what's working well for them, what's not working well for their organizations. And together we were able to develop a common care pathway for the care of diabetes and for our patients with diabetes. One of the things that specifically we learned is about an Epic-based EMR tool called the Mega Best Practice Alert, which really helps us get the care that patients need to them at the time that they need it and prepare us for the office visit so that all the best practice and chronic disease measures and metrics are addressed during that visit. So again, it's been a really good learning experience to learn from all the other organizations and to share what we're doing and to learn from the others.
To learn more about collaboratives and what they mean for you, visit AboutHealth.com.